And spring means budding flowers and blooming trees. And if you're one of the millions of people who has seasonal allergies, it also means sneezing, congestion, a runny nose, and other symptoms. But there are ways to address and treat those symptoms so you can actually enjoy the season. And here to tell us more is Dr. Gailushas from Mercy's Ear, Nose, and Throat Clinic. Thanks for joining us here today.
Oh, absolutely. Happy to be here.
And so April seems to bring on seasonal allergies. Do you see an increase in people coming in?
Well, thankfully this year, winter dragged on just a little bit, but it's starting to pick up for sure. And as you know, in Iowa, everything grows perfectly, wonderfully, but because of that, we have a lot of pollens, and we're definitely starting to see an uptick for sure.
What are the typical causes of seasonal allergies?
So the big issue is that people have sensitivities to the pollens and materials that are in the air. And for us here in Iowa, for the seasonal ones, it'll be tree pollens in the spring, grass pollens in the summer, weed pollens in the fall. And then of course, in other periods of time, we have a lot of breakdown of plant debris, so we get a lot of molds.
And what are some symptoms, the runny nose, scratchy throat, that kind of, all the fun stuff?
Absolutely. So an acute allergy attack, you'll have that runny nose, you'll have that sneezing. But some people have more subtle symptoms. They linger a little bit longer with those symptoms. So it's maybe a persistent congestion, a postnasal drip, at times where they feel that they can't breathe well through their nose, or some sinus pressure, and that can sometimes linger through the season.
So when would you tell people to get medical advice or treatment, or if there's something like some sniffles, they just deal with it?
Absolutely. I tell people when it's starting to affect your daily life, when it's really affecting the things that you like to do or want to do. If you have a few days here or there that's not interrupting your style, I would say, you're probably okay. But if you find yourself constantly having to go to the store to get allergy meds, or you're not sure, is this going to be a good week or a bad week, that's the time to talk to somebody, see what we can do through medications to help with that. And then some people have more severe sinus issues that require some more treatment to solve. So doing that, I think, is the best time to come. But people should know you don't have to have your life totally disrupted by these things.
You mentioned some treatments for those severe allergies. What would those be like? Can you explain that?
Yeah, absolutely. Well, obviously we start with just general allergy medications, antihistamines. We do a lot of topical sprays in the nose to try to relax that inflammation that the allergies trigger. But we can also do allergy therapy. So this is a desensitizing treatment where we can use some of the pollens that they're sensitive to retrain their body to be less sensitive to that.
All right, some great information. Dr. Gailushas, thanks for joining us here today.
Absolutely, happy to be here.
Stay with TV9, we'll be right back.